it seems things won't turn out perfectly when you want them to. And there is one thing you can do.
I really don't have to introduce the next speaker because she's already been introduced, but I'm glad to see that so many have stuck it out till the end of the day, and I'm sure you're really going to enjoy this part of the lecture as well. As I say, we are taping this for DVD, so if you are interested in getting a DVD, sign up. They're going to be $15, and that's going to cover the whole day. So if there's things that you missed and you need to go back to look at, they're available or will be available in the next couple of weeks. Now, with no further ado, welcome back, Dr. Kenna Stevens.
Well, thank you very much, Georgie, and thanks to all of y'all that have just stuck it out, giving up your whole Saturday to come and learn about women's health. I just really appreciate your hospitality and your kindness, and I'm sorry I had to sneak away at lunch, but my plane, I've got to be on the plane early in the morning, and I had to stock up on my ice wine and my Gasparo Valley Fibers yarn. And I got some great yarn and some great wine. And actually out there, they're having a marathon today where they're shearing the sheep, they're spinning the wool, and they're knitting sweaters that they're raffling off. And so I bought some raffle tickets and I said, will y'all ship it to Texas when I win? And they said yes, and I said, all right. And so my daughter took a video of the lady shearing the sheep, and it was quite amazing to watch. Very, very impressive. Almost as impressive as Peggy's Cove, actually. All right, we're going to change gears a little bit and talk about touch. First, I want to ask, is there anyone here that has training in BioTouch? Occasionally, as I travel about, I find people that have been to Tucson and had the training. So, not here, so that's great. Y'all all have the opportunity to go and become the first BioTouch practitioner in Nova Scotia and help other friends. So, I have a chapter in my book on BioTouch, and I think that at the book table they were also passing out a transcript of a presentation that I gave a few years ago. People have never heard of BioTouch, and so we'll talk a little bit about historical references to touch in a medicinal way, and then the modern role of touch with BioTouch. So if we go back into ancient medical text, we will see that the healers of the time were advised of special ways to touch patients to bring about healing, both in the Ayurvedic traditions, in the Egyptian medicine, in the Ebers Papyrus. Hippocrates himself wrote about ways of using touch to help promote healing. And in the New Testament, how did Christ heal patients? Oftentimes it was touch. And then in the Middle Ages, we had the king's touch. And some of you with healthcare backgrounds may have read about this, where there are actual reports of patients being healed from a physical illness or infirmity by touching the king. And at that time, the belief was that the kings were an extension of God, of divinity, and they had divine powers. And it was almost as amazing to a peasant or someone from a village to be in the presence of the king as to be in the presence of a divine being. And it's hypothesized that that experience caused changes in their immune system that would actually bring about recovery from an illness. And then in the times of Renaissance, we had some Renaissance physicians using touch to heal patients. In modern Western medicine, we really got away from touching patients. When we had Lister and the awareness about germs and microbes that were carried through touch and through physical contact. And then in the time of Descartes, we had reductionism, where really the spirit and the mind were separated from the body, and everything was quantified at a very basic biological model. And in medical texts, they even advised against touching the patient. In psychology texts, some of them prohibit even a handshake because it is thought that even in handshake, transference may occur, and that might interfere with the psychologist's relationship with the patient. And then we have negative social attitudes about touch. And certainly, touch can be abusive or improper, such as molestation. But I think that there is a role for balance as it relates to touch, and we need that. Voltaire had this to say: physicians pour drugs about which they know little to cure diseases about which they know even less into humans about whom they know nothing at all. And I know that patients complain sometimes that physicians aren't compassionate enough, that they're too cold, they're too distant, they're too aloof, and they're missing that connection with the mind and the spirit that ancient healers always had and knew how important it was to the healing process. And Dr. Cousins had this to say: the physician celebrates computerized tomography, the patient celebrates the outstretched hand. And touch is the first sense that is developed in the human experience. We have tactile sensation in the womb. And I delivered babies for a number of years, and I can tell you when the baby is born, the first thing that baby wants is touch, that human contact. They come out and they're rubbing against something, pushing against something, reaching out and grabbing something. And also at the end of their life, patients want and crave touch. I have never been with a dying patient that did not want at least to hold a hand, sometimes an embrace as they leave this life and go on to the next. So what is the skin? The skin is actually our largest organ. I mean, we certainly think about the heart, we think about the liver, we think about the kidneys and their organs and functions, but our largest organ is the skin. And the skin is really primed for tactile interactions. And I don't want to get too bogged down in the anatomy here, but biotouch stimulates the free nerve endings and the Meissner's corpuscle. It's a very light touch. And there are messengers here in the epidermis that activate areas in the brain. When we look at animal studies, ethology, we see Harlow's work with the wire monkey mothers. And some of you psychologists and counselors out there, I know you had to study this back in school, but this was when they had the two mothers constructed. And so one mother was soft cloth and a soft body, and then the wire, quote, monkey mother was where they hooked up the milk bottles. And then they put the little monkeys in the different environments and gave them a choice as to which, quote, mother they wanted to spend time with. Well, the little monkeys would snuggle up next to the cloth mother. They would only run to the wire mother just long enough to eat, and then they would go back and be next to the soft-bodied mother. And Jane Goodall had decades of work with chimpanzees in the wild, and she found that touch was a big part of their social interactions, that they would spend sometimes several hours touching each other. And that wasn't just the mother and the baby, but it was adult males, adult females, and these grooming sessions would go on for several hours at times. So it wasn't just about hygiene and picking off the little bugs, it's also about the stroking and the caressing that somehow gives them a sense of calmness, peacefulness, well-being. She even observed one of the chimps that had had a fall and was paralyzed from the waist down, and he would drag himself up to the group in order to be touched. And she also saw that the monkeys, these were usually juvenile males that would sometimes shun the grooming sessions, that they tended to have more behavioral problems. She also saw that if the monkeys were attacked, the older monkeys would go up and touch the wounds of the monkey that was injured, and they would do this periodically. And then Hindy's work was with monkey isolation, and what they did here is they took the young monkeys and they isolated them from their mothers. They were given adequate food, adequate water, adequate temperature needs were met. They were given visual stimulation, auditory stimulation, but that lack of physical contact with the mother did have an effect on the monkeys as they developed. and their behavior was affected, and they also had difficulty with intimate relationships later on. So not just the monkeys have been studied as it relates to touch, but also the primates of the sea. And it's hard for me to get a picture of a dolphin, you know? But here we are at SeaWorld a couple of years ago, and my daughter Brenna will remember this experience. So we got to go on the behind-the-scenes tour, and they took us up and introduced us to this dolphin named Sunny. Now, this is the best picture that I could get of Sunny, but if you look closely, you'll see these marks on his skin here. And so they asked us what they thought was wrong with Sunny, why he had all these scars and scratches and marks on him. And so one of us guessed that maybe he had been abused or he'd been in some type of trap or cage or something. And somebody else guessed that he had some sort of skin disease. And the trainer said, oh, there's nothing at all wrong with Sunny. In fact, he is very well developed and he is very high up in the social hierarchy, because you see the way that dolphins interact and show their approval is through physical contact. And when they do the physical contact, they're using their beaks, and that makes scars and marks on the skin of the dolphin. So if you see a dolphin that doesn't have marks, that's a dolphin that's possibly in trouble. So the more socially developed leaders of the dolphins are going to have these marks. Let me see, did I mess that up? Okay, here we go. In the research literature over the last couple of decades, we have identified what's called the NICE network. And this stands for neuro, meaning the brain, and central nervous system and peripheral nervous system, immuno, meaning the immune system, cutaneous, meaning the skin, and endocrine, meaning hormones network. And we found in our studies with rats and also with the monkeys that I mentioned earlier that many substances are released through these types of grooming behaviors and touch behaviors. And frequency of maternal touch is integral to the normal social development, immune development, brain and peripheral nervous system development of the organisms. Oxytocin is a hormone that has to do with well-being, and this is a factor as it relates to maternal behaviors of touching, grooming, and licking. And that there are changes that occur in the mother-infant interactions as they relate to stress hormones. In situations of abuse or neglect, these can be negative changes, and also when there's isolation, there's an impaired response to wounding, stress, or trauma, like we saw in Hindi's studies. This is a study that Saul Schamberg did at Duke University, and he was isolating mouse pups from their mothers and looking at gene expression. And one Sunday afternoon, the graduate student that was taking care of the little mouse pups just couldn't help himself. Now, the pups had plenty of food. They were in a nice environment that was warm. They had water. They had all that. But they weren't being touched, of course. And so he took a paintbrush and he moistened that paintbrush and he just stroked the backs of the little mouse pups. And then when they went and looked at the gene expression in these, the gene expression was totally different than the previous groups, because just that amount of tactile stimulation had caused positive changes in the gene expression. And this, Saul Schamberg then went on to lead some studies with the babies in the neonatal ICU. At this time, we were starting to resuscitate babies that were smaller and smaller, and neonatal intensive care units were opening up around the country. Of course, one of the first units was at Duke, and the nurses were told that they couldn't touch the babies. Certainly the parents were told they couldn't touch the babies. I mean, these babies were hooked up to IVs, to feeding tubes, to oxygen. Some of them were intubated. And so there was a lot of fear about upsetting or touching the babies. But what he saw was that the stress hormones in these babies were very, very high. And so the nurses came to the administration and said, we want to touch these babies. We want to see if some tactile stimulation will help decrease their stress. And so in a very methodical way, they started a research study where, in addition to taking care of the IV, the feeding tube, the oxygen, and all that stuff, the nurses would also lightly stroke the skin of the babies during each shift. And sure enough, they found very favorable changes as related to the stress hormone levels in the neonates. Now, we have our own little study. In our household, when you go into first grade, you can get your VOD. That's your very own dog. And so Brenna was actually in kindergarten, but we were given a chance to get a dog for her. One of our friends' mothers had severe dementia, and she had a little toy poodle, and she was going into a nursing home. And so they asked us if we would take Monique. And Brenna was in line for the next dog, you know, so I felt like she was a fairly mature kindergartner and that she could handle the responsibility of a dog. When we went to pick up Monique, we were shocked. Monique had been severely neglected. She looked like a rat. She had no hair at all. The fleas were so bad it had destroyed the hair follicles. And she only weighed a little under 4 pounds. And we took her to the vet. We didn't really think she was even going to survive much longer. And the vet said, well, her hair will never grow back. But, you know, with some proper nutrition, maybe, you know, you can take care of her a little bit. And so the first few months of her life, Monique wore clothes because Brenna was very sensitive about Monique's baldness and didn't want the other neighborhood kids to make fun of her. But we were amazed over the next few months with Brenna's love and tactile stimulation and care of this dog. Monique began to grow hair. And you can see this hair right here. No doubt about this toy poodle that she has got long, white, shaggy hair, kind of like those sheep that we saw this afternoon. And not only did she grow the hair, she began to menstruate again. I got a panicky call from my niece one day to the hospital saying that she found blood in the house and she didn't know what to do, and we figured out that Monique's cycles had come back. Monique was 12 years old this time. So she lived 2 years in Brenna's care and passed away of kidney failure. She did have some kidney problems when we got her. But this is our own little experiment based on Schomburg's work that we did in our household. We love Monique. All right, so what are some human studies looking at interactions and thriving? Because really what we're talking about is failure to thrive in some of these situations. So the first study I want to introduce you to is Wittison's study, and I usually have really nice little visual aids, but you know, I needed to leave enough room in my suitcase for that yarn and ice wine that I couldn't bring all my little props here. But Wittison was a dietitian, and I know we have a dietitian or a nutritionist in the audience today. I talked to her at one of the breaks. During post-World War II Germany. Now, at that time in Germany, there were lots of orphans. And so these orphanages had sprung up, and they were getting assistance from other countries in Europe in caring for these kids. And as you might imagine, a lot of the kids were underweight. And Wittison had done some earlier work showing that using jam, bread, and oranges, that kids could have an accelerated weight gain over time. And so she had 2 orphanages in her study, and we'll call orphanage A and orphanage B. And she went in and she measured the growth of all the kids. They were between the ages of 5 and 13. And then she gave charge of the diet. So at orphanage A, they were given extra portions of jam and bread and oranges. And orphanage B just got the standard portions. And Wittison went back to England. And when she came back a year later to look at the growth measurements in the kiddos, she was amazed because orphanage B had the more accelerated gains in weight and height, where they had been getting the standard rations. Now, how was that possible? Well, like any good investigator, she went and looked more closely at what was going on. Well, what she found was there were very different personalities between the overseers at the 2 orphanages. The overseer at orphanage A was a stern disciplinarian, and she especially used meal times to hand out punishments. And the overseer at Orphanage B was a very warm, nurturing type of personality, very affectionate with the kids. And I think that Whittison could have gone to the book of Proverbs and seen the truth right there. Better a dinner of herbs where love is than a fatted ox and hate therewith. In the U.S., we also had orphanages, and we had a couple of psychologists that were looking at institutionalized orphans versus incarcerated mothers with children. There were some prisons at that time where they would let the mothers have their children with them, versus the institutions with the orphans where they were on a strict schedule and they had a certain amount of protein and carbohydrates in their diet and certain amount of visual and auditory stimulation. Well, guess what? The prisoners' kids were doing better than the orphans that had all this attention to their, quote, well-being. Oh, I see somebody knitting out there. That's so wonderful. I love it. That's what I do when I go to conferences. So we also have some research studies where they're looking at mothers and infants, and they would separate the infant from the mother just briefly. And of course, an infant would kind of fuss a little bit. Now we're talking about 18-month-old children. And they tried to soothe the infant in several different ways. The mother was on the other side of the curtain. So they tested as whether or not the mother's voice would soothe the infant, whether seeing her face would soothe the infant, or not seeing her face and not hearing her voice, but the mother's touch would soothe the infant. And how many of you think it was the touch that soothed the infant? Yeah, of course. And you all know this if you're mothers or if you've cared for children, that touch, you've got to be able to have that tactile interaction to soothe the child. And then they looked at positive touch versus negative touch in infants. They actually videotaped interactions in a group of mothers and infants over time. And as you might expect, the group that had the most positive touches did better on IQ tests and on physical development tests as compared to the groups that had more negative touch, slapping, kicking, biting, pinching, hair pulling type of interactions with their moms. And Preston has done a lot of work just looking at societies in touch. And he's gone all over the world and he's characterized societies as being high touch or low touch. Now, I don't know what Canada is. But I know what France is. France is a high-touch society. And in one study, what he did is he looked at couples in a restaurant in France and then American couples at a restaurant in Florida. And the investigators actually measured how many times the man and woman touched each other during dinner. And how many times during a dinner do you think they touched each other in France? 10, 20, 100 times. What about in the U.S.? Twice. I don't know about Canada. Dr. Klein's was another research that believed that there was a touch related to emotion. And he developed this little machine where he would then have people feel an emotion. Okay, so they would think of a scenario or an image where they felt compassion, where they felt jealous, where they felt angry. And then he would have them trace with their fingers on the little machine the emotion that they were feeling. And his work is fascinating to me because he went to remote, primitive peoples, and then he went to highly industrialized societies, but it was quite common as to the patterns that they showed related to feeling certain emotions. And the pattern of compassion, I don't have it here, these are called centigrams, but it's a slow, sweeping motion toward the body. And so what Klein's did is he went and looked at centigrams in music and in art. And the Pietà has the centigram in it repeated over and over and over. It's this type of sweeping motion right here and right here and right here. So there's something that resonates inside of us with our emotions and with touch and behavior. In neurosensory studies, they've looked at pain, and these are functional MRI scans where they touched patients 3 different ways. So first of all, the investigators had to decide, what is a pleasurable touch? What is the nicest thing that you can be touched with? And what were some things that y'all think would feel good across the skin with a light touch? A feather? Silk? Velvet? Those were some of the things that were looked at. And what the investigators decided to use was silk. So the silk softly going across the back of the hand. And when I read the study, I thought about my daughter, the one that's here today, and she probably doesn't remember this, but when she was a little toddler, sometimes I would find her in my closet, and she would be running her arms across my silk blouses. And that was very pleasurable to her. So they touched them with silk, they touched them with wood, which was a neutral touch, and then what do you think was the negative touch that they ran across the back of their hand? What do you think would be negative? Sandpaper, you got it. You'll get a coupon of some sort, I don't know. Okay, so the neutral and the pleasure and the pain. And then they looked at what was going on in the brain. And it was very exciting to me to read this, because what happened is with the neutral touch, just the somatosensory cortex was activated. That's the part of the brain that sends us messages about tactile sensation. But when they were touched with the silk or with the sandpaper, parts of the brain having to do with memory and emotion were activated in addition to the somatosensory cortex. In another study, they looked at skin-to-skin contact during heel sticks with infants. Now, here in Canada, when you have a baby, do you have to go back like 10 days later up to the hospital and they stick the baby's heel and draw the little blood out, put it on the paper? Okay. This was the study that they did. And they did it with the baby in the isolette, and then they did it with the mommy holding the baby with skin-to-skin contact. And they found that there was a notable reduction in the baby's pain, as they quantified it, when mommy was holding baby skin to skin during the heel stick. And isn't that true? We hurt less when we're having that close physical contact with somebody else. Probably the worst pain I ever had in my life was when I was in labor. You know, having delivered hundreds of babies, but yet never having had a baby myself, it was quite strange to me just how badly it did hurt when you had those hard contractions. But, you know, when the nurse was standing next to my bed and holding my hand or gently placing her hand on my shoulder, those contractions seemed to hurt less when we had that physical contact. And so there are lots of benefits of touch reported in the literature as it relates to anxiety, depression, autism, dementia, bulimia, chronic fatigue syndrome, burn patients, cancer pain, headaches, arthritis. And we think that this goes back to the enhanced immune endocrine factors that are occurring with this type of touch. So if we decide how we're going to touch somebody, you know, how can we do it? I mean, it's kind of hard just to approach somebody and say, oh, I want to touch you. People might not be totally comfortable with that. But with BioTouch, there's a very specific methodology that's followed, and most of my patients are very comfortable with it. In fact, they ask for it, and they want to be touched. They want to have BioTouch as part of their care. So what we can conclude is that touch is essential to the human being's development and vitality, and that it exerts effects both locally on the surface of the skin as well as distally in the brain, and that if we deprive humans of touch, there are physiological, psychological, social, behavioral changes as well as immune endocrine dysregulation, and that social interactions that involve caring and touch might improve the health and well-being of all ages. So BioTouch, in my opinion, offers a safe, effective modality of social tactile interaction. And these are some patients that are receiving BioTouch. And so you see, you can even do it in an ICU setting where they've got telemetry cord around their neck, where they have IVs, where they have oxygen. There's nothing special that has to be going on or not going on. And here's a patient in a clinic getting a BioTouch treatment by one of our trained BioTouch practitioners, and then another patient getting a treatment. But again, it's always skin-to-skin contact, and 2 fingers are used of each hand by the BioTouch practitioner. And it's a very light touch. When we teach it, we say it's like a butterfly was landing on the skin. That's how lightly the patient is touched. And you can practice it on the back of your hand. I see some people practicing that. Okay. And so I was introduced to BioTouch by this lady right here. This is Sister Mary Shield, and she was a volunteer at St. Elizabeth's of Hungary Hospital and Clinic where I worked in Tucson, Arizona. And the International Foundation for BioTouch is located in Tucson, Arizona. And Sister Mary would come to the clinic and do BioTouch sessions on our patients. Well, I thought it was crazy. I mean, until my patients started telling me, oh, I've got to have my BioTouch with Sister Mary. And I started observing, hey, this is making a difference in their stress and in their pain. And I want to investigate this, and I want to find out more about it. So the practitioners use the first 2 fingers of both hands to lightly touch specific points on the body. And over time, the combination of touching the points seems to enhance the body's natural healing ability. So we as practitioners never claim, like the king did, that we are healing the patient. It is just awakening within the patient their own innate ability to heal by activating that immune endocrine response. There's no special meditation or attunement or centering or anything that has to happen with this, like you might hear about with other energy therapies of Reiki and therapeutic touch. This is just very, very simple, very Western based. This is our hospital where we did our pilot project in 2003. And so we were looking at 8 domains: physical functioning, physical role, bodily pain, general health perceptions, vitality, social functioning, emotional role, and a mental health index. And we were doing the sessions once a week. So the patient came in, they got BioTouch once a week, and we were looking at these different domains. And I thought from my experience in Tucson that a couple of things would get better. My hypothesis was that their pain would get better because I had already observed that. But I was really amazed at the fact that, and here I am doing a BioTouch right here, that at 8 weeks, let me show you the data. Where is it? Okay. At 8 weeks, we saw significant improvements in all 8 domains. All 8 domains were statistically significantly improved. And I'll go back and show you these again, okay? So we got the baseline data, and then they had once weekly for 8 weeks, and then we did a follow-up, and then we looked at them 4 weeks even after the last treatment session, and we also kept weekly logs of what else was going on with the patients. And again, the practitioners were instructed to touch points indicated by the patient's clinical condition. BioTouch is so easy. You can teach this to a 9-year-old child. I have taught it to children to do on grandma and grandpa for their osteoarthritis pain. It's your knee hurts, you look at the diagram, this is where you touch the knee. Your head hurts, okay, this is where you touch the head. So there's nothing really complex or complicated about it. It's not like an Eastern therapy, and I believe in acupuncture's benefits to my patients, but if I go into my acupuncturist and I say I'm having headaches, what does she do? She touches my foot, And so with the Western mind, it's like, no, you need to touch here because this is where my pain is. And so with BioTouch, you're touching the area where they're having the discomfort. We had clinical settings, outpatient, inpatient, and work site. We went to some work sites to do BioTouch, and the women could not wait for the practitioner to get there. They wanted to be the first one to have their BioTouch. I love massage, and I don't know if we have massage therapists here today, but massage therapy is expensive, and it's also time intensive, and some of my patients are just not able to avail themselves of that type of touch therapy. BioTouch, cheap, easy, efficient. So we did not have any adverse outcomes. Nothing bad happened when we were doing BioTouch in this patient population. Okay, then we looked at another group of women. These are the women that we were talking about today, the sandwich generation, women that have a high social burden, that are taking care of a lot of people while they're trying to navigate aging on themselves. So there is a stress related to aging and menopause. There's certainly caregiver stress in these women and social burdens of aging women. And we had two groups we had a control group, no BioTouch, and then we had a BioTouch group. And we were looking at clotting factors, inflammatory factors, blood pressure, and weight. And we found that after the session that the BioTouch group had an increase in interleukin-12 levels, and I'll talk about this in a minute, and I'll talk about it right now. You say, well, what is interleukin-12? Well, interleukin-12 is a cytokine, and it's very important as it relates to immune function. And certain infections such as TB and the common cold are related to changes in interleukin-6, which then cause changes in the T cell ratio. And we think that this type of stress-induced T cell shift contributes to the susceptibility or the progression of these infections. And this was fascinating to me because the disease most cured by the King's touch in the Middle Ages was scrofula, which is an old name for tuberculosis. And TB is really involved with this interleukin-12. Also, in major injuries, interleukin-12 is suppressed. With tumors, there's deficits of interleukin-12, and then with allergy and atopy, there's a deficit of interleukin-12. And of course, we know allergy is stress-related, and also cancer susceptibility or progression of certain tumors seems to be stress-related. So we measured stress hormones in the two groups of ladies, and this is our control group. They are not getting BioTouch, and we did not see any drop in their nocturnal cortisol levels. But in the BioTouch group, their cortisol levels did go down when they were getting the BioTouch. It was not statistically significant, however. It approached statistical significance. We also looked at other immune signaling factors 72 hours after BioTouch, and we found that the immune response was enhanced in the patients getting BioTouch. And these are two of my PhDs that worked with me on the study, Dr. Pierre Neunschwander, Dr. Anna Kurdowska. You know, I get to travel, I get the glamour, I get to stand up in front of people, but I have so many people standing behind me and supporting me. And so I want you to see, you know, some of their faces too. But we looked at gene expression. These are the steps in a microarray experiment. We don't have any biochemists here, so I'm not going to belabor that. This is some of the data that I had to mine because all of these represent different genes that we were measuring. And when they handed me my raw data on the gene microarray, it was about this thick. And I couldn't afford the software program to mine the data, but I could get a 30-day free trial of the software program. And my family suffered immensely during those 30 days. Because I was frantically on the computer mining this data. And the kids would be like, Mom, are we having dinner? Yes, in a minute. Mom, we're really hungry. Okay, just a minute. Mom, it's 8 o'clock. Can we have dinner now? And they made a tremendous sacrifice. Thank you, Brenna, for that. But this is the genetic fingerprint of BioTouch. So all of that just to say that we were able to measure genes that were upregulated and downregulated when we did skin biopsies pre and post BioTouch. And in the red are genes that were upregulated, and in the green are genes that were downregulated. And you say, well, what did these genes have to do with? Well, first of all, they had to do with the stress response. And so we have a pie graph here, the response to stress, metabolism, response to external stimulus and endogenous stimulus, and then cell growth and maintenance. And then they also had to do with the immune response with correcting oncogenes, providing antioxidant activity, catalytic activity. All this to say, it makes you better, okay? It makes things better. And see, I'm going to go on here in the interest of time. So this is my schematic, and I have this in my book if you're interested in reading more about BioTouch. But we have all of these stressors that we've talked about today, the social isolation, death of a loved one, lack of exercise, lack of sleep, negative attitudes, toxic relationships, a toxic environment, all of these things coming in. But we found that BioTouch can help to buffer some of this, and maybe through the regulation of the immune response and the stress response, we could potentially be able to prevent some of these diseases, or at least minimize the expression or progression of some of these conditions. So if you're interested, you can go to justtouch.com. Here we are at one of my daughter's school health fairs doing BioTouch, and we got the principal to sit down and get a BioTouch session. And if you I just want to conclude with the idea that you all have the capacity to heal and improve your health within you. Dr. Albert Schweitzer said each patient carries their own doctor inside them. We are at our best when we give the doctor who resides within each patient a chance to work. And thank you for your attention.